With that, Maria Vicent, I'd like to invite you to the stage. First presentation, Maria Vicent from Valencia will talk about the issues in conjugation chemistry, polymers versus polymeric micelles. Maria, please, the floor is yours.
Thank you so much. Good morning, everyone. Thank you for the invitation. It's really a pleasure for me. I'm not Kataoka, I'm so sorry, so I can't give you my whole translation. But because I'm working in polymer drug conjugates, and the first title they gave to me was Polymeric Conjugates versus Polymeric Micelles. I thought, they are not different, they are very similar. And thinking on Kataoka's work, you think that in the purpose that we have in the nanofield here, like to move from the design, the conformational behavior, the conformation in the biology, and the interaction with the membranes, and thinking in the patient, so we have all the concept together, I decided to discuss on specific features that could really make the difference, so articulate polymeric drug conjugates to polymeric micelles in an adequate manner that we can control these bio-nano interfaces to a specific subtype of patients. So you can really understand this descriptor, these physicochemical properties, to fine-tune the nano responsiveness, mainly the PK/PD, the pharmacology, pharmacodynamics, looking for a specific patient subpopulation. So if we think like that, and placing the polymers or polymer therapeutics field within the field of nanomedicine. We are in the organic type of materials or maybe hybrids, and looking at the concept of polymer therapeutics is evolving from the earliest days with Ruth Duncan and Harold Ulrich and Kopacek. You think that for a small molecule, for example, that is the focus we are going to give today, in this session, we can go from something that is in the clinic, a classical polymer drug conjugates, where we have differential linking chemistry, responsiveness linking chemistry compared to nanoparticles or the classical polymeric micelles. But if you move to the polymeric micelles like Kataoka, you have the first row here. They are also having the same type of linking chemistry, but articulated in a different manner. So you have a polymer that has a amphiphilic character, and you have in the hydrophobic bit, you have a hydrophobic drug that it triggers self-assemble. So these self-assemble properties are the ones that we have also need to control to have this bio-nano interface. And we can articulate it from the linking chemistry, that is the differential feature of these polymeric micelles from Kataoka or the polymer drug conjugates compared to the classical encapsulation efficiency. So what I was saying is like the differential feature is this linking chemistry and how we can articulate solution conformation playing with that. So we have a different control site for the PK/PD studies. So the polymeric micelle from Kataoka, this is a very nice review from Horacio Cabral and Kataoka's group, and also you see that the classical micelles encapsulate hydrophobic drug in amphiphilic polymers. You have a hydrophilic block, a hydrophobic, where you can conjugate or not the drug, and this linking chemistry can be bioresponsive. But in the concept of polymeric micelles from Kataoka, you are also encapsulating a second drug or the same drug to have this conjugated drug having a more hydrophobic interactions, a stronger hydrophobic interactions to have this core micelle more stable. So that's the concept behind Kataoka's polymeric micelles that went to clinical trials. When we move to polymer drug conjugates, we are going to start with like a polymer, like a homopolymer, and the same. So we are looking for small molecules, multivalent polymers to conjugate different drugs, combination of single drugs, through a bioresponsive linking chemistry, and then we can really articulate with different type of active moieties or whatever as all the other types of nanomedicines. But these homopolymers, we can also use the polymers to trigger self-assembly itself. So the beauty of the polypeptide, that is the polymers that we are working in my lab, is that we can really articulate at the use of different amino acids with different properties, side chain functionalities, zeta potential, and also starting for a different different core as macro-initiator using NCI ring opening polymerization approaches, we can get very nice differential versatile architectures, and different architectures can also trigger these self-assembled properties that the polymeric micelles, for example, or the block copolymers are used to have on this amphiphilic. You can also use a branch system with a hydrophilic corona or a block branch system that you can also play with different architectures. So in our lab, we're playing with star-shaped systems. We could, starting with a BTA core and modulating the length of the branches, we can modulate the architecture, the conformation of the systems. Increasing concentration in a non-ionic solution, we can really increase the size of the system of these polyanions, changing the zeta potential of the structure. So increasing concentration, you decrease the zeta potential. These architectures are self-assembled in a non-ordered structure when you have long chains of amino acids, and they are not able to be disrupted under only under ionic salts. And looking at the circular dacryosim, we see a shift when you increase concentration, and this is telling you that you have a change in the electrostatic interaction in the branches. So we don't have a supramolecular assembly, we're having something from the branches. So we identify that this is named the ordinary transducer behavior, where when you have a very dense cloud, when they're working with polyanions or polyions in general, you have a really dense cloud of electrons and the control ions at the Debye length, you can generate transient dipoles that stabilizes these self-assembled structures. And this is very quick. And then depending on how you architecture your unimers, depending on the hydrophobic ratio or the moieties you put in the branches, you can have different final solution conformations. So we have different architectures, but thinking on polymeric micellization, then usually we work on systems that really collapse and play with the branches to have these not ordered architectures that we can really control. But these systems, if you really put it in the physiological environment, they are disrupted. So we need to stabilize, and we will discuss in this session the importance of the stabilization of this polymeric micelle solution conformation in the physiological environment. So in our case, the polymer itself is not stable at all in the circulation. So we need to stabilize using cross-linking strategies. And to do cross-linking strategies, our thought was to maintain around 100, 120 nanometer size during circulation, and then being able to cleave the cross-linking and then have something that is around 4 to 8 nanometers to penetrate deeply in the site of tumors, for example, or a very difficult way to diffuse. So we can get longer circulation time, a very efficient penetration in tumor site. So to do that, we are doing orthogonal chemistry, a bottom-up strategy. So we are adding different chemistries in the unimers, where we are using these self-assembled processes in a non-ionic fabric, like in water, and then we cross-link, like for hydrazone, tile groups, or even non-cross-linking if we want to have vaccination, non-bioresponsible, for example, and then we conjugated the drug. So we have also here different points of bioresponsiveness. The cross-linking that can be biodegradable, non-biodegradable, so you can maintain the size independent on the conditions. And also when you're adding the drugs in the polymer, that we can add it before or after cross-linking to look at release kinetics and exposure of the drug to the bio-nano interfaces. So we have a kind of a versatile architectures where we can articulate how the kinetics of the drug release and also the kinetics of the micelle self-assembled structure can really last, or really the size, how long we can maintain this size. Thinking always that the polypeptides are biodegradable materials that at the end we will end up with endogenous metabolites that are amino acids. That's why we really like these starting materials. So thinking on the linking chemistry for the drugs, apart from for the stabilization, for the cross-linking. So, for example, if we want to go to the tumor microenvironment, in a tumor microenvironment we have different atmosphere. We have metalloproteases, we have reactive oxygen species, we have different redox protection, differential pH. So all these can be triggers to articulate our linking chemistry with the drugs as well as the cross-linking strategy. And also, if we think on the cells itself, and the models that we have to use to design our systems, we need to characterize and the conditions that we encounter in our cells and even the cell subtypes. For example, this is breast cancer subtypes. Making a 3D, we have different expression of the normal marker, estrogen receptor, progesterone receptor, HER2 positive or negative, and it's differential if it is 2D or 3D, but more importantly, looking at triggers for release of the drugs, you can also find differences between the subtypes of cells and between how you are analyzing your cells with your drugs. So you are having a 2D spheroid mammosphere or having a 3D organoid, or is really changing the levels of reactive oxygen species, is changing the level of the redox environment, and it's also changing level of proteases. So the cells that you are encountering, depending on where it's surrounding and how you are testing to articulate and to rationally design your system to move to the patient, these things you have to really think about. And also you can have to use it in your benefit, because depending on the subtype, you can also analyze the patient tissue, you can analyze the model, and understand if this patient will be benefiting for a design of a bioresponsiveness in your nanomedicine that is because of a redox potential or because of high levels of reactive oxygen species. So you can do that in a personalized manner. Having the organoids, patient-derived organoids, also you have to characterize to look for these insights. But not only the linker, you have to think on the linker alone. The linker is coming with a drug. So for example, very recently we just published this paper 2 weeks ago, where we like a lot this self-immolative linking chemistry, because the redox environment is something that is critical in the tumor microenvironment, and there is some tumor cells, for example, where you have a very high redox behavior, and even we are designing things for neurodegeneration, and the redox there is also very important. So in this study, what we are usually, the self-immolative linking chemistry, you use a drug that has an amino group to conjugate to have a SS degradation in a self-immolative manner, and the linker they use is the bisulfite ethyl linker chemistry. But this linker is really changing depending on which drug you are conjugating to, and also depending on which models you are using to. So this linking chemistry, you can fine-tune the release kinetics combining the linker plus the drug. So for example, it's like a basic organic chemistry, so you have to have a really good leaving group, you need to play with electronegativity and also resonance structure. So we did a study with having drugs that these drugs are, we use them in the lab as chemotherapeutic agent or molecular targeted drugs for combination therapy, and exploring the differences in using the same linking chemistry, in the same polymer architecture. You see they have a secondary amino group, you have a primary alcohol, a primary amino group, so you have very differential release kinetics. We implemented design of experiments to really optimize LCMS and characterizations to have a robustness in all the analysis. And if you look at the release kinetics for the different linking chemistry drugs, you see that the Sikimov, for example, that has a primary alcohol, releases very fast from the linking chemistry. If you have a primary amino, also it releases very fast. When you have a secondary amino group and you have these resonance structures, you have a very slow release kinetics, as you see here with niraparib, rucaparib, or fasudil. If you change the bisulfite ethyl by a more resonance delocalization structure with having a phenyl group in the middle, so we can really enhance the release kinetics of those drugs that are not working well with the classical SS ethyl linker, for example. So you see here there is a huge change, or implementing not only the redox but also protease like valine citrulline release kinetics, for example, to help to the redox potential. So having the same linking chemistry, we call the new and the old linker, we have a huge differences for the same drug with the same linking chemistry with the same polymer. So this is not all. So then when you put it and you analyze it, the release kinetic is important, the drug is important. When you test them in 2D versus 3D, the same conjugate with the two different linking chemistry, they are not only the parameters of the redox, the parameters are also the diffusion, the uptake kinetics, and the levels, for example, of the GSH levels that we have, I mentioned before, the different levels of redox in the models. So having a conjugate of fasodil with SS-ethyl or SS-phenyl, the 2D usually works, is more efficient than the 3D, but that's as expected. But also, if you look at the comparison in the 3D models or the 2D models, it's kind of a controversial to see that, yes, it's releasing more, but is working less. So you have always to arrive to a compromise with the uptake in the diffusion in the whole tumor or in the whole model, and also the levels of the trigger that you have on site. So we are, in the design of this linking chemistry, the in vitro release kinetics, these are the release kinetics done in vitro in the cells itself. So we put it with an LC-MS method, we extract the free drug in the cell. So we are not doing an in vitro release kinetics with DTT. We are really analyzing the drug that is released in the 3D or 2D model. So, and you have release differences. So this has to be implemented to design better the final conjugate that is going to be transferred to next stage. And the 3 minutes left, I'm going to take the 20 minutes so we can discuss later. So I put an example of a combination because this is even more important when you have 2 drugs on it. And this is we have a combination with doxorubicin, that is a chemotherapeutic agent, with dasatinib, that is a tyrosine kinase inhibitor. And the dasatinib is an ester bond linking chemistry, and depending on the hydrophobic and the esteric hindrance of the amino acid you put in the linker, you can really fine-tune the release kinetics. The linker for doxorubicin is already optimized in our lab as a short hydrazone to have good effect, but if you change just one amino acid when you link the dasatinib, you can have a very different profile with the release of one drug respect to the other, and that really makes a huge difference. So both of them, having both drugs in the same polymer, in our case, makes a difference when you have this tyrosine kinase inhibitor and the doxorubicin, because the target are in the same place. So one sensibilizes the other one. These are, you see that, I'm sorry, these are with organoid-derived patients, triple-negative breast cancer, 2 different organoids. So you see that in both cases, when you have both drugs in the same polymer, the IC50 value is lower, so it's working better. And moving to in vivo, this is reflecting to have in the 231 metastatic model, orthotopic, we have a better tumor reduction, and also a very nice reduction in lung metastasis and also lymph node metastasis. And the last bit, just to finalize with the last slide, so we monitor also some biomarkers. In our case, in the 231 model, we discovered the growth factor stimulating, so it's really a factor that you can monitor for monitoring disease progression in this model. When you move all these to a different polymer architecture, the linking chemistry also needs to be adjusted. So in this case, the ester bond was not needed because if not, the release of dasatinib was too slow. And in this case, what it was important, it was ratio between dasatinib and doxorubicin. It was much lower ratio of dasatinib doxorubicin, was 1 to 10 instead of 1 to 1. And in this case, with the star, because we have a great accumulation in the tumor, but you have a greater reduction in the tumor size, so we have 80%, and greater reduction also in the lung metastasis. And I hope I gave you an overview that linking chemistry is very important. You can fine-tune the stability of the micelles, the release kinetics of a drug, the release kinetics of a drug in front of the other in the combination therapy scenario, and all this together with a polymer that allows multivalency, biodegradability, you can really fine-tune. And we had really nice example yesterday of a dendrimer with a conjugate that with the linker chemistry you can also make a difference compared to the encapsulation in this kinetics whenever it's needed. So the last slide, the most important, this is my group, the people who is doing the work and all the collaborators and funding agencies. Thank you so much for your attention.